November is National Epilepsy Awareness Month, which brings needed attention, to one of the most common neurological conditions in the world. Medical experts are working to educate the public on the signs, symptoms, and solutions surrounding epilepsy, with ongoing advancements in treatment, early diagnosis, and community support. This month serves as an important reminder that increased awareness can help improve the lives of millions living with epilepsy. Joining us now on the Splash Live for an important conversation on the topic is vascular neurologist Dr. Schechter. Dr. Schechter, thank you so much for joining us today.
Thank you. Hi, Jake. Welcome.
Glad to have you back with us, and for a very, very important topic. As I said, November is National Epilepsy Awareness Month. Can you explain why this awareness is so important for the public and medical community alike?
Yes, definitely, because epilepsy is a neurological condition that can be treated and controlled. Seizures are due to a sudden electrical discharge that occurs within the brain, and this can cause various clinical symptoms like loss of consciousness, loss of awareness, can lead to injury, broken bones, chipped teeth. So recognizing seizures is the first start to finding their cause and working on a treatment plan to prevent them.
That's absolutely right. Now, for those unfamiliar, how would you say, what causes epilepsy to develop in certain individuals?
So there can be many causes. Sometimes the causes are not known, but risk factors for seizures could include certain things like head injuries, traumatic brain injury, or history of previous head trauma. Sometimes it can occur after a stroke or after an infection in the brain, or it might occur due to a chemical imbalance that creates abnormal firing, leading to the clinical event known as a seizure.
Wow, lots of ways that this can happen. And what are some of the most common symptoms or warning signs that someone might be experiencing seizures or could possibly have epilepsy?
So sometimes there is no warning and a seizure can just come very suddenly, but there may be what's known as an aura, like a feeling or a sensation. It could be a rising up feeling out of the stomach, or a change in smell that occurs first. And then as the electrical discharges spread, the seizure can evolve and start to involve motor function. If both hemispheres become affected, there can be a loss of consciousness or a loss of awareness.
Sounds like a very scary situation that we don't want anybody to have to go through. But let's say you're in a situation where you witness somebody having a seizure for the first time. What should somebody do to help this person become comfortable?
So the first thing would be to stay with the patient and help to reduce the risk of further injury. You could, lay the patient down on their side, keep their mouth and airway clear. And if it's a new onset seizure or if it's a prolonged seizure, they really need to go into the emergency room. So you would want to call EMS to get the patient transported so they can begin an evaluation and start medication to control the seizure.
Of course, try to get things under control as quickly as you possibly can. Now, I would imagine in recent years that the treatment and management of epilepsy has evolved over that time. What have you seen, especially with advancements in medication or surgical options with epilepsy?
Yes, definitely. So we have many more medications now that are very effective. The newer medicines not only work better, but they have fewer side effects, and they're easier to take and easier to tolerate. So there's been a lot of advance in terms of controlling the seizures with medication. There are also some other options for the 30% or so of seizures that aren't controlled with drugs. Devices that stimulate the vagus nerve can be looked at. And also there can be some surgical procedures done in more severe refractory cases where the actual scar tissue that is the source of the epilepsy can be removed.
Okay, that's amazing that we've had these developments in these recent years. Now, you said sometimes when it comes to these seizures, they can happen just completely out of nowhere. But I am curious, are there certain, maybe some lifestyle changes or maybe some triggers people with epilepsy should be aware of to help manage their condition in the future?
Yes, definitely. So we call that seizure precautions, and so, for example, sleep deprivation is a known trigger of causing seizures or making them more likely. It can lower the seizure threshold. So getting adequate sleep, making sure you're eating properly, making sure you're not having other uncontrolled medical conditions like high blood pressure that's out of control or diabetes with sugar that's too high. So maintaining, optimal control of existing conditions, avoiding alcohol, avoiding sleep deprivation, and just good common sense, healthy living will help to reduce the risk of seizures.
Yeah, good common sense comes in. That's something everybody should remember, and to combat a lot of different things. For those just joining us right now on the Splash Live, I'm talking with vascular neurologist Dr. Stephen Schechter, talking about National Epilepsy Awareness Month, which this is the month of November, which is Epilepsy Awareness Month, and things to watch out for, symptoms, signs, and what to do when you see somebody or if you know somebody who is struggling with epilepsy. Now, there's a lot of information about epilepsy, a lot of great information, a lot of great resources, but I imagine there's also maybe some misconceptions or some stigmas surrounding the disease. What do you see surrounding epilepsy today in terms of misconceptions?
Sure, there are some, older misconceptions out there that we know are not true. Epilepsy is not contagious. Not all seizures are associated with convulsions necessarily. They can be staring spells or more subtle automatisms like twitching or staring, but not necessarily a full blown convulsion. Another stigma is that you can't drive with epilepsy. That's not true. You only can't drive for 6 months after a seizure. But if you're controlled beyond that and you're on seizure medication or not, you can still drive. So that's something to discuss with your treating neurologist about the risks. Um, and the last stigma that sometimes we still hear is that people with epilepsy are challenged intellectually or mentally, and that's not necessarily true either. So many patients, most of our patients lead normal lives with optimal seizure control on medication with very effective and well-tolerated treatment options.
It seems like a lot of people think that epilepsy might be some sort of a death sentence and that it's going to take over the rest of your life. And it sounds like that's not the case. And as you said, you could still live a very fulfilling life even while dealing with epilepsy.
Absolutely, that is correct.
And with something like this, how important would you say is early diagnosis? And what kind of testing or evaluation should someone seek if they suspect seizure activity?
Right. So early diagnosis is important because if you have epilepsy, you want to be treated for that for all of those reasons mentioned to reduce the risk of uncontrolled seizures, injury, and sometimes uncontrolled seizures can actually cause some damage to certain parts of the brain. So getting it diagnosed and treated is really the goal. The treatment regimen depends on the type of seizure, and the workup to diagnose them would include imaging, advanced imaging with an MRI scan, and doing brainwave testing known as an EEG or electroencephalogram, which is recording and measuring the brain waves, looking for an abnormal electrical rhythm. Electrical irritability is really the feature that we see on the EEG that is associated with seizures.
You're absolutely right. And it sounds like technology is really playing a huge role today in improving outcomes for people that are living with epilepsy, wouldn't you say?
It is, yes. Advanced imaging studies are now available. There's some devices now that can detect changes in heart rate very early, which is associated with the beginnings of a seizure, and then it can activate or fire a current to prevent the seizure waves from spreading. So there's a lot of technology, a lot of epilepsy monitoring devices, and advanced imaging that can really help us monitor and maintain optimal control.
A lot of valuable resources available for those who need them. Where can people go to gain maybe a little more information or to learn a bit more about epilepsy if they think they might be suffering from it, or if they know somebody who might be having some of those symptoms?
Sure, they can certainly look online or check out the Epilepsy Society webpage. But your best resource is going to be with your neurologist. So if there is clinical suspicion for seizures, one should see a treating neurologist to counsel them and begin a diagnostic evaluation and then start a treatment plan.
Important to check with neurologists just like yourself, Dr. Schechter. We really appreciate you joining us today here on the
Absolutely.
Splash Live. I have one more question before we let you go. What message would you like to share during National Epilepsy Awareness Month to encourage understanding, compassion, and support for those affected?
I would say there is hope. There is definitely many good treatment options. Like any medical condition, this can be adequately treated. The vast majority of patients can be controlled or become seizure-free with medication. And for those less common, more refractory patients, there are many options still available to treat those patients as well. So it's a treatable condition, and those patients that can receive optimal control, they do very well and continue to lead normal lives.
Great words to remember. Dr. Schechter, thank you so much for joining us today here on the Splash Live.
Absolutely. Thank you. My pleasure.